I'm Dr. Michael Harrison, and today I want to share something that could genuinely save your life. Not with expensive equipment, not with complicated medical tests, but with something you can do right now in about 5 seconds using nothing but two fingers. In my 40 years of treating patients, I've seen far too many people dismiss the quiet warnings their bodies give them, not because they were careless, not because they did not care about their health, but because nobody ever took the time to show them what to listen for. That changes today. Before we go any further, I want to be clear about something important. While I'm a physician sharing evidence-based information, this video is for educational purposes only. It's not a substitute for personalized medical advice from your own doctor who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into something that I believe every person over 50 should know. Let me tell you about a patient I'll call Robert. Robert was 71 years old, a retired high school teacher. Calm voice, sharp mind, the kind of man who still did the crossword puzzle every morning in ink. He came to see me about 3 weeks after what he called his incident, and the way he described that morning has stayed with me ever since. He told me he felt completely normal when he woke up. No pain, no fear, no warning signs that he could recognize. He made his coffee the same way he always did. He went outside to water his tomato plants. He came back in and stood at the kitchen sink rinsing his hands, and that is when something happened that he almost ignored. Out of pure habit, something he had done occasionally since his doctor mentioned monitoring his heart years earlier. He placed two fingers on his wrist, and something felt different. Not fast, not slow, just uneven, like a drummer who kept missing a beat. He shrugged it off, finished his breakfast, sat down to read the paper. 10 minutes later, he felt suddenly weak and lightheaded. His wife called the paramedics, and when they arrived, they told him something that changed how he thought about his body forever. They said his heart rhythm had likely been unstable for hours, maybe longer. His body had been trying to warn him, and that moment at the sink, that 5-second check, was the clearest signal of all. Robert kept saying the same thing to me in my office. He said, "I wish I knew that mattered. I wish someone had told me what to listen for." And that is exactly why I am making this video today. I want to give you what Robert did not have. A simple, calm, reliable way to check in with your heart. Something you can do anywhere, anytime, without fear, without fancy devices, without needing anyone else. Because here is what the research actually shows. Large cardiology studies demonstrate that irregular pulse patterns can precede dangerous heart rhythm problems like atrial fibrillation by days or even weeks. The heart loses coordination before it loses strength. It whispers before it shouts, and most people never hear that whisper, not because the body fails to speak, but because nobody taught them how to listen. Today, I am going to teach you exactly that. We are going to cover 5 things. First, I will show you the 5-second pulse check itself, step by step. Second, I will explain why rhythm changes before anything else does. Third, I will tell you what to do if something feels off calmly without panic. Fourth, I will share how often to check and how to build this habit without becoming anxious. And fifth, I will reveal a quiet mistake that many people over 50 make that actually destabilizes heart rhythm without them ever realizing it. If you stay with me through this entire video, you will understand your heart in a way that most people never do. And that understanding could give you something priceless. Time. Time to notice. Time to respond. Time to protect yourself before a small irregularity becomes a medical emergency. Let us begin with the most important skill. Here is what I tell my patients about the 5-second pulse check. This is not a test. This is not a diagnosis. This is simply a moment of listening, something you can do quietly without pressure, without counting, without trying to label anything as good or bad. The key is understanding that the pulse is not just about speed. Most people think they are checking how fast their heart is beating, but speed alone is misleading. A heart can beat slowly and still be unstable. It can beat quickly and be perfectly coordinated. What matters first is regularity. A healthy heart keeps time even when it changes pace. Think of it like music. A song can be fast or slow, but if the drummer keeps steady time, it sounds right. When the drummer starts missing beats or adding extra ones in random places, something is wrong. Your pulse tells you whether your heart is keeping time. Here is exactly how to do it. Find your radial pulse. That is the pulse point on the inside of your wrist, just below the base of your thumb. Use your index and middle fingers. Never use your thumb because your thumb has its own pulse and will confuse the reading. Place those two fingers gently on your wrist. Do not press hard. Do not hunt around aggressively. Just rest your fingertips there and wait. The pulse will appear. It is close to the surface and reflects your heart rhythm very clearly. Once you feel it, you do not count beats. You do not calculate your heart rate. You simply observe for about 5 seconds. That is long enough to sense the pattern, short enough to stay relaxed. What are you listening for? Consistency. A steady pattern feels predictable, like footsteps on a quiet path, one beat following another without hesitation. Tap, 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 tap. Even spacing. No surprises. An unstable rhythm feels different. You might notice a pause that feels slightly too long, or two beats arriving too close together. People often describe it as fluttering or stumbling, like the heart hiccuped. Now here is something important that most people get wrong. One odd beat does not mean danger. Everyone has occasional irregular beats. I have them, you have them. They are usually harmless. What matters is whether the irregularity repeats within those few seconds. When irregularity repeats, it becomes information. It becomes something worth paying attention to. This is not something you do once and forget. It is something you become familiar with over time. When you know what your normal rhythm feels like, change becomes much easier to recognize. Familiarity creates safety. Awareness creates time. This reminds me of another patient I will call Margaret. Margaret was 68, a retired nurse, and she knew more about health than most of my patients, but even she had never learned to check her own pulse in a meaningful way. She came to see me after experiencing what she described as a strange fluttering sensation in her chest for about 2 weeks. Nothing dramatic, no pain, just this occasional feeling that something was not quite right. When I asked her if she had checked her pulse during those moments, she looked at me and said, "I never thought to do that. I figured if it was serious, it would hurt." And that is the belief that gets so many people into trouble. When we did an electrocardiogram in my office, we found early atrial fibrillation. Her heart had been giving her signals for weeks. The fluttering she felt corresponded to irregular rhythms that were absolutely detectable at the wrist. If Margaret had known what you now know, she could have documented those episodes herself. She could have come to me sooner with clear information. She could have given herself the gift of earlier intervention. Margaret did beautifully, by the way. We caught it early enough that lifestyle modifications and careful monitoring were enough. No major procedures, no hospitalization. She still sends me a card every Christmas. That is the power of listening early. I want to share something else about Margaret that I think matters. When she first felt those flutters, she almost talked herself out of coming to see me. She told me later that she kept thinking she was probably overreacting, that it was probably nothing, that she did not want to waste anyone's time. How many people have had that same thought? How many people have felt something subtle and dismissed it because they did not want to seem like they were making a fuss? Margaret's instincts were right. Something was happening. Her body was speaking to her. The only missing piece was knowing what that sensation meant and what to do about it. That is exactly what I am trying to give you today. Not fear, not hypervigilance, just understanding. Because when you understand what your body is saying, you can respond appropriately. You do not overreact. You do not underreact. You simply act with clarity. Now let me explain why rhythm changes before anything else does. Because understanding this will help the 5-second check make even more sense. The heart is not just a muscle, it is an electrical system, and electrical systems are sensitive. They respond quickly to small changes in your internal environment. Dehydration is one of the most common triggers I see, even mild dehydration. When you are low on fluids, your blood becomes slightly thicker, your electrolytes shift. The electrical signals in your heart slow down and lose precision. Many older adults drink less water intentionally to avoid bathroom trips or nighttime interruptions. I understand that instinct, but your heart feels that decision almost immediately. Research from the American Heart Association has shown clear connections between hydration status and heart rhythm stability. Stress is another quiet factor. Not panic, not emergencies, just ongoing tension, worry, rushing, poor recovery from daily challenges. Stress hormones like cortisol and adrenaline interfere with electrical timing in your heart. They do not need to be extreme to have an effect. I had a patient, let me call him Frank, who was 64 years old and had recently started caring for his wife, who had been diagnosed with dementia. Frank was not sleeping well. He was not eating regularly. He was carrying this enormous emotional burden every single day. He came to me because he kept noticing his heart felt jumpy at night. When we checked his pulse together in my office, it was clearly irregular. Not dangerously so, but noticeably unstable. We talked about his stress. We talked about his sleep. We talked about building in small moments of recovery throughout his day. We worked with his cardiologist to monitor things carefully, and over about 6 weeks, as Frank learned to care for himself while caring for his wife, his rhythm stabilized significantly. The stress was creating electrical instability in his heart. His body was trying to tell him. Medication changes are especially important to understand. A new blood pressure medication, a dose increase, a missed dose, even supplements you might think of as harmless. The heart adapts to these changes, but adaptation is not always smooth. Rhythm disturbances often appear days after a medication change, which makes the connection harder to see. Low potassium and magnesium also play a major role. These minerals stabilize electrical conduction inside heart cells. When levels drop, coordination weakens, beats lose their even spacing before strength declines. Many seniors have borderline low levels of these minerals and never know it. Sleep disruption matters more than people realize. Fragmented sleep, sleep apnea, poor oxygen delivery during the night. Oxygen instability directly affects heart rhythm. Many people blame their fatigue on age when it is actually a signal of imbalance that deserves attention. Here is what ties all of this together. None of these triggers usually cause pain. They do not create drama. They create subtle instability. That is why they are ignored. The body whispers instead of shouting. And that is exactly why the 5-second pulse check works. It listens where pain does not speak. All right, stay with me here. We are about to get to the really practical stuff, but I want to make sure you understand what we have covered so far. Your pulse reflects your heart rhythm. Rhythm disturbances often appear before pain, before weakness, before collapse. Checking your pulse takes 5 seconds and requires no equipment. What you are listening for is regularity, not speed. And many everyday factors like dehydration, stress, medication changes, mineral imbalances, and poor sleep can create rhythm instability without causing obvious symptoms. Now let us talk about what to do if something feels off. The moment someone feels an irregular pulse, the instinct is often fear. Thoughts race ahead to worst-case scenarios, but the most important thing to understand is this: an irregular pulse is information, not an emergency by default. The first response should never be panic. And I say that as someone who has spent 40 years in medicine. Panic tightens your nervous system and actually makes your rhythm harder to interpret. Calm is not denial. Calm is clarity. So the first step is simple. Pause. Sit down if you are standing. Breathe slowly through your nose for a few breaths. Give your body a moment to settle before doing anything else. Many irregular beats disappear once the nervous system calms. Stress alone can create temporary rhythm changes that resolve within minutes. After that pause, wait a few minutes. Then repeat the same 5-second pulse check in the same relaxed way. Consistency matters here. One brief irregular moment that disappears is very different from a pattern that returns. If the rhythm feels steady again, that is reassurance. Make a mental note. Stay hydrated for the rest of the day. Pay attention to your sleep that night. No urgent action is needed in that moment. Your body often corrects itself when conditions improve, but if the irregularity repeats, especially at rest, that is when attention matters. Not panic. Attention. This is where documentation becomes incredibly valuable. Write down what you felt. Note when it happened. Think about what you were doing earlier that day. Were you stressed? Did you miss a meal? Did you start a new medication? Did you sleep poorly? These details help your doctor see patterns instead of guessing. The next step is contacting your primary care physician or cardiologist, not the emergency room, unless symptoms escalate significantly. This is a conversation, not a crisis. Doctors can evaluate rhythm safely with simple tools like an ECG or a short-term heart monitor. These tests are routine and completely non-invasive. Now I want to pause here and remind you of something important. I am not suggesting you change any medications or treatments without speaking to your prescribing physician. What I am sharing today may inform a conversation with your doctor, but any changes should only be made under their guidance. There are moments when immediate help is necessary. If irregular rhythm is accompanied by fainting, chest pressure that does not go away, sudden shortness of breath, or confusion, that changes the situation. Those symptoms indicate instability beyond rhythm alone and deserve emergency attention. But most pulse irregularities do not present that way. They appear quietly, repeatedly, without drama. And that is why awareness saves time. One of the most important things you can do is avoid self-diagnosis. Avoid searching the internet for every possible cause. Avoid jumping to conclusions. Fear accelerates symptoms that might otherwise remain mild. Instead, treat the pulse like a conversation. Listen, observe, respond thoughtfully. Your heart rewards calm attention. Let me tell you about a patient I will call Helen. Helen was 73, a retired accountant, sharp as a tack, lived alone after her husband passed away several years earlier. She started noticing occasional irregular beats during her evening reading time. Instead of panicking, she did exactly what I am teaching you today. She checked her pulse calmly. She noticed the irregularity was real but not constant. She wrote down when it happened and what her day had been like. She called my office the next morning and came in for an evaluation. Her ECG showed occasional premature ventricular contractions, which are extra beats that feel like flutters, very common, usually harmless. But we also discovered she had been drinking much less water since her husband died because she no longer kept the same routines. Helen increased her hydration. She started taking short walks in the evening instead of sitting for hours. Within 3 weeks, those irregular beats had nearly disappeared. What Helen did right was respond thoughtfully without panic. She gathered information. She sought guidance appropriately. She made reasonable changes, and her heart stabilized. That is the power of calm awareness practiced consistently. Now let us talk about how often to check your pulse and how to build this habit without becoming anxious or obsessive. The healthiest approach is simplicity. 1 or 2 calm checks a day, not more. The body needs rhythm, and so does the mind. The best times are predictable and quiet. After waking in the morning, before sleep in the evening, moments when your nervous system is already settled. Checking during stress gives confusing information. Your heart rate naturally rises during stress, and you may feel beats that seem irregular but are actually just your heart responding to tension. Morning is useful because your body is rested. There is no caffeine yet, no activity, no emotional stimulation. It gives you a clean baseline. Evening is helpful for a different reason. It shows how your heart behaved through the day. Patterns emerge when timing is consistent. What matters is not perfection. It is repetition without urgency. Irregular checking creates doubt. Regular checking creates confidence. This is not something to do during fear, not during palpitations, not while rushing. Those moments distort perception. Think of this habit like brushing your teeth. You do not keep checking your teeth all day. You do it at set times, then you move on. If several days pass with a steady rhythm, that is reassurance. You do not need to increase checking. Stability deserves trust. If something feels different one day, you observe it. You do not chase it. Observation without judgment is key. Some people worry that checking their pulse will make them fearful of their heart. In reality, familiarity reduces fear. When you know what normal feels like, unusual sensations become clearer and less threatening. Uncertainty creates anxiety. Knowledge creates calm. This habit should support your independence, not undermine it. Confidence grows when awareness is balanced. Let me give you a simple way to remember what we have covered about checking your pulse. I call it the 3 C's. Calm, consistent, and connected. Check calmly, not anxiously. Check consistently, at the same times each day, and stay connected to what you feel without judging it. Those 3 words can guide this habit for the rest of your life. Calm, consistent, connected. Now here is something that might surprise you. This thing that most people think is harmless is actually making rhythm problems worse. There is one habit I saw repeatedly in seniors with new rhythm problems during my 40 years of practice. It is not dramatic, it is not unhealthy on the surface, and almost no one connects it to their heart. It is the gradual reduction of daily movement, not exercise, just movement. Many seniors believe that if they are not exercising, they are at least resting, but what they are actually doing is staying still for long periods. And stillness changes circulation, and circulation affects rhythm. When the body sits too long, blood pools in the lower extremities. The return of blood to the heart slows. Oxygen delivery becomes uneven. The heart responds by adjusting timing, and that adjustment often appears as subtle rhythm instability, especially at rest. This is why many irregular pulses are noticed while sitting or lying down, not during activity. The nervous system becomes more sensitive in stillness. Another factor is shallow breathing. When movement decreases, breathing often becomes shallow without awareness. Shallow breathing alters carbon dioxide balance in your blood, which directly affects heart rhythm. Seniors rarely notice this because it happens slowly, year by year. Add in dehydration and mild electrolyte depletion, and the system becomes fragile. Fragile systems respond with irregularity, not collapse. I want to be clear, this is not about blaming rest. Recovery matters. Sleep matters. Stillness becomes harmful only when it replaces movement entirely. The heart evolved for gentle, regular motion. Simple actions matter enormously. standing up every hour, walking for 2 minutes around your home, stretching your calves, taking deeper breaths throughout the day. These small movements restore circulation and stabilize rhythm. I had a patient I will call Thomas, who came to me at 69 years old, with persistent irregular pulse episodes. He had already seen a cardiologist, who found no structural problems with his heart. Everything looked fine on paper. But Thomas kept feeling these irregular beats, especially in the evening. When I asked about his daily routine, the picture became clear. Thomas had retired 2 years earlier, and had gradually become quite sedentary. He spent most of his day in a recliner, reading or watching television. He would go hours without standing up. His legs had become stiff. His breathing had become shallow without him realizing it. We started simple. I asked him to set a gentle timer that reminded him to stand up and walk around his living room for just 2 minutes every hour. I asked him to practice taking 10 deep breaths 3 times a day. I asked him to drink a full glass of water every few hours. Thomas did not add any formal exercise. He did not join a gym. He just reintroduced gentle movement throughout his day. Within 6 weeks, those evening irregular beats had almost completely stopped. His heart was the same heart, his body was the same body, but by restoring circulation and oxygen delivery, his rhythm stabilized. The heart thrives on rhythm beyond its own. I think about Thomas often because his story illustrates something so important. The solution to his problem was not a new medication. It was not a procedure. It was not expensive or complicated. It was simply reconnecting with a pattern of movement that his body had evolved to expect. We live in a world that makes stillness easy: comfortable chairs, entertaining screens, convenient delivery services that mean we never have to leave the house. These are not bad things, but the heart does not know about modern convenience. The heart still expects movement, and when it does not get that movement, it begins to struggle with rhythm. The good news is that the solution is just as simple as the problem. Small movements, done consistently, can restore what extended stillness disrupts. This brings us to the bigger picture. When you step back and look at everything we have discussed, a clear pattern emerges. Protection does not come from fear. It comes from calm awareness, practiced consistently over time. The heart responds best to steadiness, not urgency, not constant monitoring, but gentle, repeated signals of safety and balance. The 5-second pulse check is not meant to turn you into a patient. It is meant to keep you connected to your body before problems grow loud. Listening early prevents emergencies later. Movement does not need to be strenuous. It needs to be regular. Standing up, walking briefly, breathing deeply, letting blood move the way it was designed to move. Circulation and rhythm are partners. When one improves, the other follows. Hydration matters, sleep matters, stress management matters, medication awareness matters. Small daily choices quietly shape heart stability more than most people realize. What surprises many seniors is that calm routines often do more than medications ever could alone, because calm restores coordination, and coordination is the foundation of rhythm. None of this requires perfection. Missed days do not erase progress. Occasional irregular beats do not undo stability. The body is forgiving when it feels respected. This is not about eliminating risk. It is about reducing surprise. Surprises are what turn manageable issues into emergencies. When you know your normal rhythm, notice change early, move gently, and respond thoughtfully, you create time. Time is the most powerful protection your heart has. I have seen people in their 70s and 80s regain confidence simply by understanding these signals. Confidence lowers stress. Lower stress stabilizes rhythm. Stability creates more confidence. It becomes a beautiful cycle that reinforces itself. The calm that protects the heart is not passive. It is intentional. It is built through listening, moving, and responding without fear. And when calm becomes a habit, the heart follows. Always. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you have learned today and have a conversation with your doctor about what is right for you. If you found this helpful, if you learned something today that you can use, I would really appreciate it if you hit that subscribe button. I release new videos every week specifically designed to help you take control of your health and maintain your independence as you get older. And I promise to always give you the science without the hype. Drop a comment below and tell me, have you ever noticed your pulse feeling irregular? What was that experience like for you? I personally read every comment and I would love to hear from you. In our next video, we are going to explore something closely related: why many heart warnings appear at night, and what that timing reveals about your nervous system, because the heart speaks differently in stillness. Until then, take care of yourself. Your body is wiser than you know. You just have to learn its language. Here is to your health. I am rooting for you.